Mr. Speaker, first I'm going to talk about the cuts to the public service. Cutting 40,000 public servant jobs. I'll just give you an idea what that looks like. They started this austerity already. They cut 3,000 jobs at the CRA call centres. Ask anybody in this House what it looks like in their offices right now, and the backlog of constituents calling our offices, Mr. Speaker, because they simply can't get through to CRA. But CRA has no problem finding people in this country when they owe them money. And I'll give you an example, Mr. Speaker. Ryan, who is a volunteer firefighter in Merville on Vancouver Island, he got chased, get this, Mr. Speaker, because he got the new volunteer firefighter tax credit that I helped fight for, and people in this House supported eventually, and the government adopted. But the government's chasing Ryan around. Ryan spent his summer fighting wildfires. Can you imagine? Chasing around a volunteer firefighter when we know, Mr. Speaker, they still haven't dealt with, the Panama Papers and the corporate, misuse of the tax system, the tax havens that are out there. They're spending their time chasing around volunteer firefighters like Ryan. So, Mr. Speaker, imagine a further cut at CRA. Imagine cuts at Veterans Affairs. We saw the Conservatives cut a third of the staff at Veterans Affairs, and the disability application backlog grew to 50,000. This is not a time to cut the public service. This is a time to strengthen it, especially as the economy is struggling, Mr. Speaker. Also, we saw the government do nothing to deal with the corporate greed and the inflation crisis that's happening right now, Mr. Speaker, whether it be at the pump or at the grocery till, or when people are trying to access the internet or get basic, their cell phones covered. Those prices are continuing to skyrocket, Mr. Speaker, or when they go to pay their rent or pay their mortgage. But last year, Mr. Speaker, get this, RBC made a record $16 billion. Bell made $6.3 billion. What did they do? They laid off 700 employees. Yeah. Loblaws, they made over $2 billion, and Imperial Oil, they made $1 billion almost last quarter, $5 billion last year, and then what did they do? They also laid off almost 1,000 employees, Mr. Speaker. So there's the corporate responsibility and how it's playing out at the top for Canada's big corporations. In fact, Mr. Speaker, we have the lowest corporate tax rate in the G7. And what else do we have? Record profits. Even Conservatives, Mr. Speaker, in Britain, they brought in an excess profit tax when the profits were so out of control. And Mr. Speaker, I want people to win. I want small businesses to win. I want medium-sized businesses to win. I want large businesses to win. We all do. But it can't be on the backs of everyday people or when people are struggling and suffering. It can't be at their expense. It can't be where they're preyed upon by companies that have control over the market on basic needs of everyday Canadians. Mr. Speaker, what's happening right now in our country is we're normalizing this out-of-control, raging corporate greed. And Mr. Speaker, I'll tell you how that's playing out for everyday Canadians. The gap between the richest 2/5 of Canadians and the poorest 2/5 of Canadians has reached the widest level since Stats Canada started doing this work and recording it and collecting data. The driver, Mr. Speaker, is highlighted that the share of disposable income primarily due to investment gains. That's what's driving it, Mr. Speaker. So this needs to be addressed. And in this budget, this government did nothing to address the corporate runaway greed that's taking place in this country. Mr. Speaker, also when it comes to the climate emergency, we have a climate emergency happening. They didn't invest in a clean energy grid across this country like they could have, a transformational opportunity, a generational and transformational opportunity that would have met the Prime Minister's needs. They failed to do that. Instead, they're focusing on building pipelines, Mr. Speaker. Pipelines that have no plan, no money behind it, no proponents, and they're continuing to bring forward these ideas that failed under the previous Conservative government. Mr. Speaker, they killed the Greener Homes program, a program that was employing contractors and labor right across this country. They just killed it. A very successful program and one that was certainly helping reduce emissions. In terms of housing, Mr. Speaker, They still haven't committed to an amount that is going to be for co-op non-market housing. As a product of co-op housing, I know what it's like to have safe, secure, and affordable housing. When they announced their $13 billion for housing, they still haven't committed a percentage of that will be non-market, or a percentage of that will be geared to income, Mr. Speaker, with a set amount of the threshold that should be 30%, Mr. Speaker. So where are we at now when it comes to housing? We're at 3.4%. We can look to England and France, they're about 16, 17%. Denmark's at 21%. The Netherlands are at 34%. Well, you don't see the homelessness that you see here, Mr. Speaker. You don't see what it looks like. 3.4%, every MP can go outside in their community, they can go to a center in their community, and they can see what 3.4% non-market housing looks like. Homelessness like we've never seen. Skyrocketing out of control homelessness, Mr. Speaker. So these are things that need to be addressed, and this government has failed to do that. There's many things that are missing. Pharmacare was mentioned, but no commitment, despite the fact that the Pharmacare Act passed in this House, and Liberals tout the Pharmacare plan that they were going to deliver. No mention of the toxic drug crisis, Mr. Speaker. Over 52,000 Canadians have died from a poisoned drug supply. We have the third highest death rate per capita in the world from toxic drugs, despite the fact that we've seen other countries like Portugal take a holistic, integrated, coordinated approach to responding to their toxic drug crisis. Mr. Speaker, mental health. The Mental Health Commission has now done a report that says it's costing the Canadian economy $200 billion a year. Unaddressed mental health. This is impacting everybody. Everybody in this House, everybody who's got a constituent in their riding. Nobody is left untouched by the mental health crisis that's happening. And it doesn't have to be this way, Mr. Speaker. But right now, provincial and territorial governments are spending half of what's being spent in the OECD on mental health. And it's costing the Canadian economy. This is an economic, nation-building, important investment that needs to happen right across this country. We need parity with mental and physical health, and it needs to be legislated, Mr. Speaker. There's still no mention of when they're going to, fund the salmon programs that are sunsetting at the end of March. Friendship Centres agreements sunset in March. They can't wait for an economic statement. No investment when it came to ship recycling, Mr. Speaker, or shipbuilding on the West Coast. Despite the fact that we need capacity, absolutely critical. We are Conservatives often talk about the need for BC ferries to be built in this country, but the former Conservative finance minister in 2010, he said that these ferries can't be built here, that they shouldn't be built here, basically, and he removed a tariff that was a 25% tariff that was meant to be in place to be there as a barrier so that ships were built in Canada instead of outside the country. In fact, they were built, those ferries in Poland, Mr. Speaker, which you know quite well. But those ferries should have been built in Canada. And that tariff should never have been removed. Lastly, I'm going to talk about the disability tax credit. Over 250,000 disability tax credit forms were processed in 2022. Now, Mr. Speaker, this amounts to about 250,000 hours of family physicians' time. And this was highlighted in the College of Family Physicians of Canada recent report. All that has to happen, Mr. Speaker, is if the government, instead of investing $10 million in this budget to help people get $150 to go pay a doctor to do it, they could just say, hey, if you've got disability in your province or territory, you automatically qualify for the disability tax credit. Seems to make sense. Seems to make sense, especially with a healthcare system that is way beyond capacity. We need to be innovative. We need to reduce red tape. We need to support people living on disability.